Working with parents and guardians is one of the most important aspects of working with children in therapy. But I also know for a lot of therapists, especially therapists who aren't parents themselves, can get really scared about this. And one of the things that can be really scary is the idea of unintentionally over-disclosing to the parent or guardian. And before I tell you how I talk to a lot of my supervisees about this, hi, I'm Dr. Carolyn Gray. I'm a licensed clinical psychologist and clinical supervisor. I help new clinicians build their skills and their confidence. If that's your sort of thing, follow for more. So instead of explaining things to the parents about what's going on in therapy, we want to instead talk to the parents about what they can do differently for the child. And that does not have to have shared content with what's coming up in session. Let me give you a couple of examples. So let's say I'm working with Sarah. Sarah has been struggling with anxiety and depression, and she's getting some low grades that she knows is coming in this semester. But she is nervous about talking to her parent. Her parents have historically prioritized academic performance. I am not going to disclose to the parents about the low grades, but I do also want to prepare the parents so that they can best support Sarah. In that case, I might have a call with one of the parents and talk to them about the benefits of praising effort and strategies for demonstrating unconditional love to children. Or let's say I'm working with Adrian, who's 7 years old, and he's been struggling with sleep. Parents report behavioral issues. We have trouble sitting still in school, things like that. And maybe the kiddo is disclosing to me that his bedtime is really irregular, that there's a lot of inconsistency at home. And perhaps the discipline that he's receiving is quite punitive and authoritarian in nature, which based on my assessment, I know is going to be contrary to what this child needs. So in the phone call with the parents, I'm not going to be focusing on, oh, did you know that Adrian told me that this is how you discipline him? But instead, I will talk about positive parenting practices that I believe can be helpful for Adrian, including structure in the home and providing the rationale as to why that's helpful. And I would tie that to the behaviors and things that I know the parents can already see or are already aware of. What about a more complex situation? Let's say we have a 16-year-old, Cheyenne, let's call her. Cheyenne has a boyfriend who she knows her parents won't approve of because he's involved in some illegal activities. But also at home, Cheyenne is the one who's making all the meals for her younger siblings. She's the one who is helping get them to school. And let's say mom works evenings. Mom doesn't get home until 11:30, and mom is the only adult in the home. I would need to be thinking about, what does Cheyenne need from her mom that mom can actually access for her? Cheyenne probably needs to be seen and valued by her parent. She may also need some acknowledgement that the responsibilities and expectations that she's been given aren't really very fair, because maybe they can't really change based on the family circumstances, but mom can acknowledge that this is a lot to put on another kid. Maybe I also need to talk to mom about not sharing all of mom's dating plans with Cheyenne, because Cheyenne is not her friend. So I might be talking to mom about the importance of interpersonal boundaries with our children and about appropriate responsibilities for different developmental levels, while I'm also acknowledging the limitations of this family's structure and thinking about how we can best balance both given the realities. And none of that requires me to disclose anything that mom doesn't already know.